everybody. Hope you're doing well. Happy Wednesday. This is an opportunity to have Dr. Santora answer any questions that you have related to sports, we'll just say. And this continues to be a challenging area, as you're aware, considered high-risk activity depending on the sport. And so Lisa has a quick slide deck she's going to provide to all of us, and then we'll get right into questions. If you want to ask a question, just raise your hand or put it in the chat and we'll take it from there. Okay, Dr. Santora, thank you.
Good morning, and thank you for meeting with us today. I'm just going to give a brief overview of where we are in the community with COVID-19, because I think that explains, again, just some of the context for providing additional guidance where it relates to sports. So the good news is that as of yesterday, and this changes regularly, California as a state is considered to be in moderate levels for COVID-19 activity. That does not mean that's consistently across the state. There's counties with very high activities of COVID-19, and there's counties like Marin County that still has substantial levels of COVID-19 activity. We are experiencing this one as part of the Delta wave that we saw surge after the 4th of July. And we had our second expected hump right after Labor Day, which is still holding on to us a little bit, which is why we're still in substantial levels. And just to clarify, the guidance that was issued around sports was issued specifically due to the Delta variant and the surges and the outbreaks and clusters that we had been seeing in our county over the summer, and the experience that we had, especially with youth sports over the summer, being centers of COVID activity in our community. So you can jump ahead. That being said, the good news is we're still on the way down. It's not, as I said, it's kind of lingering in this post Labor Day hump, but you can see because of the vaccination rates in our county, we did not have the same peak that we experienced in January 2021, which is what other communities are experiencing right now. Delta is much more contagious. Our vaccine rate did not protect us as well as we thought it would. We had at the point that Delta surged for the fourth wave, we had 73% of our total population vaccinated. We are learning that with Delta being so much more contagious that we really need to have nearly 85% of our total population vaccinated in order to have that level of community immunity or herd immunity. That's going to be much more challenging because, as you've seen, the Delta variant itself can evade the vaccine that all of us have hopefully received. And the good news is the vaccine is very effective at preventing severe disease and hospitalizations and ER visits. And that's what is not being experienced in communities across the nation where there's lower vaccination rates. You're hearing hospitals talk about crisis standards of care and bringing in federal resources to support medical surges. The vaccine rates in our community have protected us from those surges, but we're still seeing substantial levels of COVID-19 activity. And as you saw, by the end of July, we had high levels of COVID-19 activity due to transmission predominantly through the unvaccinated adults of our community. Those were the primary drivers of COVID-19 activity, but there were significant levels of breakthrough cases in our community as well. Again, that's just due to the trickiness of the Delta variant, where we are protected from severe disease. It just takes a little time for our bodies that are vaccinated to recognize the Delta variant. So you can jump ahead. And this shows you how we look at it. We see the differences between our vaccinated population and our unvaccinated population. We look at all different factors. The orange is our unvaccinated group. So you'll see the case rate. So that's the number of cases per 100,000 is significantly higher and has been in our unvaccinated group. There's around 20,000 residents in Marin County who are eligible right now to be vaccinated and have not been vaccinated. And so on any given day, and if you can imagine, we have around 240,000 individuals who are vaccinated in our community. On any given day, 50% of those cases that we see are among unvaccinated people. So even though they represent a much smaller proportion of our community, they are overrepresented in cases in our community. And most concerningly, from our perspective, they're overrepresented in our hospitalizations. Since we have seen the vaccination in our community, and especially with Delta, 90% or more of hospitalizations on any given day are among unvaccinated individuals. What's concerning to us is that it's predominantly among a younger population, Our 75 plus and 65 plus populations are highly vaccinated. So the social networks that they travel in, even if they aren't vaccinated, which is very rare, are highly vaccinated. So we're not seeing older adults in our hospitals. On average, the range of people who are hospitalized who are unvaccinated range between 30 to 50 years old in our community. You can jump ahead. All right. So the state, when they drafted their state guidance, was drafted pre-Delta, which again is why you have seen across the state, the counties provide additional guidance in the face of Delta. So they really enforce at the state level that masks should be worn indoors, except if we know there's specific sports that it's impossible. For example, wrestling and MMA and water polo and swimming, where it's not feasible to wear a mask indoors. Then also recognizing the state, and I know this is more for sports, it also recognizes music and band as other higher risk activities. And this is consistent with CDC guidance because of higher levels of exhalation. And it's absolutely consistent with the outbreaks and clusters that we have investigated since this summer. A lot of our cases have been tied to sports and into the performing arts. So when possible, that it's been recommended to shift all activities outdoors. If it's not possible, everyone indoors should be wearing a mask, except those individuals at the moment of competition or practice when they can't wear masks because it's a choking hazard. And again, there's only a few exceptions to that. So this is in place, but many counties, and you can jump ahead, opted to issue more stricter guidance. So again, the only order here, and I did a lesson before between orders, mandates, and guidance and recommendations. So orders are the must of the world, and guidance and recommendations are the should of the world. Even so, you should wash your hands, as I think is the best example. Many people opt not to wash their hands after going to the bathroom, but that is not a scientifically sound decision not to wash your hands. And so we recommend everyone should wash their hands after going to the bathroom. The guidance that we're providing are predominantly should recommendations with the exception of masks. And we're recommending it because of what data is showing us locally, what data is showing us nationally, and the science of why we are recommending this. So this is data-driven, science-based recommendations that are in the should land, not in the must land. And so we're gonna run through this pretty quickly. When we share the deck, you'll have the links to our updated guidance. And just to frame it, this was not developed in a silo. So the Association of Bay Area Health Officers, which ranges from San Mateo up to Napa and across to Solano and Contra Costa, convened together to draft this unified guidance because we know there's a lot of practice in sports and athletic activities that go across the region. And so we didn't want there to be inconsistency from county to county in the Bay Area. And then what we saw across the state is if you look at guidance from YOLO and either further afield, you'll see that it looks very, very similar to what was drafted by Abajo because all counties across the state were experiencing what we were. But the state guidance didn't provide sufficient guidance for preventing the outbreaks that we were seeing across the summer, and that we, due to the high risk nature of the sports and the activities that are addressed in this guidance, we saw a need for additional recommendations for those groups that were coordinating these activities. So again, I've said this again, masks must be worn indoors for competition practice and physical education. The exception are those where masks would be potentially causing harm to an individual. So water polo, swimming, wrestling, martial arts, not one-on-one martial arts where there's a risk for choking hazards. Masks are not required, but are recommended outdoors on the sidelines. The biggest concern, and I go outdoors, I'm in the soccer mom troop right now. It's not when people are sitting 6 feet away from each other on the sidelines. It's when people are huddling close together and not maintaining that distance. So our kids are at higher risk when they're bunching up on the sidelines themselves. The good news is that we continue to see that outdoors is not the preferred environment for COVID-19. So it's recommended, especially in those huddle times outdoors, that people put their masks on, but it's not required. We are strongly recommending vaccinations among all participants in these high-risk activities. Just as a note, we now have booster vaccines that are available. The Centers for Disease Control have identified school staff as an occupation that may receive a booster shot. because of the congregate nature of schools themselves, it's considered a higher risk location. So if you're a school staff, if you haven't been vaccinated now, you're already eligible for a booster shot. And the reason why we are strongly recommending everyone who participate be vaccinated is because the most common occurrence that we saw over the summer and into the fall season is the outbreaks or clusters of disease usually start with an unvaccinated adult. So of all the cases that we're seeing, when I showed the case rate among unvaccinated adults, unvaccinated persons in our community, it's really important to note it's not among kids and adolescents, even though kids under 12 remain unvaccinated. They're not driving COVID-19 activity in our community. It's adults between 19 and 50 years old who are unvaccinated that's driving activity in our community. So most outbreaks we investigate start with an unvaccinated person who tests positive and exposes others to COVID-19. And because of there is a risk of breakthrough cases, again, as I mentioned, there's not a perfect match with the Delta variant and the Pfizer or the Moderna vaccine. So booster shots are recommended, and we are recommending that everyone who participates in these high-risk activities should be vaccinated. Jump ahead. So these are the definitions of high-risk activities, and straight from the Centers for Disease Control and California Department of Public Health. So singing, shouting, band, exercise, I know that's not this group, but those are high-risk activities. I have a lot of people in my inbox telling me that these are not high-risk activities. I can assure you that they are. We have investigated outbreaks and clusters that are directly connected with these activities, and in the past have investigated a large tuberculosis outbreak that was directly connected with band and chorus. So anytime you're exhaling more profoundly, I guess prolifically and profoundly, you are going to be expelling potential COVID. The other high-risk sports, and this is what was identified, and that's again for California Department of Public Health, is listed below. It does include outdoor soccer, just because the nature of the closer outdoor scrumming. So, but again, and I saw a question pop up. Outdoor masks would be recommended, but is not required when kids or students or adolescents are playing outdoors. But these are the activities that we're identifying as high-risk activities due to the nature of the contact that they're having and the intensity or the vigor of the activities themselves. Jump ahead. So testing. So this is not a requirement. This is a recommendation. And so this is the first time we are recommending a screening of asymptomatic persons in the school setting. So prior to the release of this guidance, we did not recommend screening of asymptomatic students. We have seen it as very low yields. If a student is asymptomatic, they most likely do not have COVID-19. And so when we just randomly sample asymptomatic students, we have not been identifying a significant number of cases. There is an exception now because of these high-risk groups, which again are groups that are together often, they're participating in higher risk activities. We have seen significant outbreaks and clusters among these groups. We are recommending that you implement a testing program for unvaccinated participants. And so it's not just a rapid antigen at home we're recommending a more rigorous testing. So once a week if you're using a PCR test, and then twice a week if you are using the rapid antigen test. And it's not recommended that people just use their home-based antigen test. So this is the only group that we're recommending, not a requirement, not a must, just to know that we're recommending it because we are finding cases in these groups because of both the practice activities, the carpool activities, and all the activities that surround these higher risk activities. You can jump ahead. So outdoors, always when possible, try to continue to maximize distancing. Those are ways that we protect ourselves, especially with Delta variant still circulating at substantial levels. Really be aware of the pre and post event activities. That's where we've seen a lot of higher risk as people engage in social gatherings before sports events and after sports events. The huddles that people are engaging in during the sporting activities themselves. That's when there's the highest risk of transmission. And then carpooling itself, especially if carpooling much longer than 15 minutes, you're going to have a higher risk of transmission. And that was one of, again, a common pattern we saw over the summer is sporting teams participating in activities together, carpooling together and then having a positive among an unvaccinated person that then resulted in breakthrough cases among their close contacts. Can you jump ahead? Again, just congregation, a lot of this is just common sense. The more time people are congregating without a mask in close contact, that's when you have the highest risk of COVID transmission. If you do have transportation, make sure masks are on if they're indoors on a bus, or if they're using carpools, masks are on. Keep the windows open and the fans high, and try and keep the same people traveling together. That really helps when there is a positive case, that we can really narrow who would be considered the true close contacts. Overnight travel is a much higher risk activity, especially when students or athletes and groups are sharing rooms. And really, we are strongly discouraging socializing with other teams. It's those social restaurant-based activities when people are eating indoors together, their masks are down, that are also affiliated with these sports-related cases. Jump ahead. That's it. All right. We went through that pretty
Okay, Lisa, let's just go to the questions that have come. Let's just go to the questions that we've seen so far. Should masks be worn during cross country?
They're not required to be worn during cross country. Students probably should have a mask on them. So if they, at the end of the race, when they're gathering, I mean, people gather at the end of the race. That's when, it's not like you end the race and people just go back and among themselves. So we would just recommend that they have a mask available to them. So at the end of the race, if they find themselves in a crowded condition and they want to put their mask on, that they have the availability.
Okay. What is guidance for masks for athletes playing sports, soccer, flag football, in games or practice?
Outdoors masks are not required. They would be recommended, especially if it's among unvaccinated groups. My student does not like wearing a mask outdoors and enjoys that time as an outdoor mask time. So that's a place where my son does not fully follow a recommendation. And I think that's the reason why I'm comfortable with that, is that it is a lower risk activity when it's outdoors. So we're not expecting to see our youth sports have all the outdoor youth sports that kids are wearing their mask when they're practicing or in games outdoors. But an acknowledgement, though, is that we have, again, positive cases among coaches. So what we would recommend, because of the risk of breakthrough cases, I see the coaches are the ones that are there. I feel much reassured when the coaches are masked, not because I'm concerned per se about the coach giving my 11-year-old COVID, but when a coach is exposed to 15 to 20 unvaccinated under 12 years old, it's protective to them to wear that mask when they're outdoors on the sidelines with the kids. So it's not required to wear a mask outdoors in those settings. When the biggest risk would be when there's bunching, and also to really accept those that are wearing masks, because masks are going to be part of our society for a while, where there's going to be people on my side where I'm comfortable not wearing a mask being vaccinated, and my kids, though, are not comfortable. I find it really odd. My kids like wearing their masks when they're outdoors. They have an intrinsic sense when they're in crowded settings and they wear their mask. And I'm often telling them that they can take their mask off, and we just need to accept. And I see kids playing soccer. Some kids are wearing masks, and that's great. And they feel comfortable wearing the mask when they're playing and when they're on the sidelines. And I think we just need to accept that. We're looking to be updating. Again, this guidance was issued in the world of Delta. And so when we return to moderate levels, we anticipate relaxing our recommendations around masks towards that more optional mask wearing activity when outdoors.
So Lisa, these next two are, first, any recommendations of fans at high school indoor games?
They should be masked. So if you're indoors, you should be masked. If you're indoors, we would recommend that they should be also vaccinated. It's especially what we've heard now, they're much more crowded games. So you're going to have a higher risk of potential contact, but that's up to the individual facility or school, whether they're going to require masking. Not require masking. You must wear a mask, require vaccination or testing. And we appreciate the burden of requiring testing, but that's something to consider if you want to require vaccination.
So Lisa, are you going to put this in the strongly recommended category, that proof of vaccinations should be checked for indoor spectators? Or where are you landing on that, just to help?
I would just say recommend. It's not a strong recommendation.
Okay.
Everyone's, and the only reason for that, if people are not wearing a mask, that's the first thing, is if they're indoors, they must wear a mask. So that's not even a strong, that's a requirement. We did issue a strong recommendation just this week that you might not be aware of for the Marin Center. That's a facility that has more than 1,000 persons, which qualifies as a mega event. And that's why there was a recommendation that everyone be vaccinated at going to an event at the Marin Center. Specifically, it's the only, from my knowledge, and you can correct me if I'm wrong, it's the only indoor space in the county that can host more than 1,000. But if you have a crowd, that being said, if you have a crowded basketball gym and everyone's right next to each other indoors, it's the same conditions that 1,000 person Marin Center has. So that being said, we're hopefully on the tail end of the Delta variant, and we do know we have high vaccination rates in our community. Your greatest risk, honestly, in these scenarios, I want to stay upfront, our sporting community is probably among our most undervaccinated. We're not an undervaccinated community, we're a well-vaccinated community, but we've seen within adults in the sporting community, there's stronger hesitance around vaccination because of the sense of natural protection from, stronger physical activity, good health, be healthy eating and active living among sports. But we've also seen that is not the best proxy for preventing severe disease for COVID-19 activity. So Marin County residents on a whole will be well vaccinated. We do have groups within sports that might have higher number of individuals in Marin County who are not vaccinated. It would be teams from traveling from other counties, even as close as Solano, that have significantly lower vaccination rates. So just to be prepared that when you're, and also coming from counties into Marin County, where we're going to be at moderate activity within the next week or so. And you may have travelers and visitors to your indoor locations that are coming from high risk activities. So that's going to be your greatest vulnerability. So
what's the protocol when a member of the team tests positive? Is the whole team considered a close contact?
It depends on the sport. So what we would recommend is you contact us. And so, because we've had a lot of, we most recently had confusion with, it was a soccer exposure where we don't want to, our goal is keep kids in school and only identify the true close contacts of the persons who test positive for quarantine and or not quarantine because they're vaccinated. Ideally, every student in middle and high school that's participating in these high risk activities, if they're over the age of 12, are vaccinated. So if you're vaccinated, you're just going to be monitoring for symptoms and you can keep attending school. So that's our primary goal. Please contact us because we don't want everyone to be automatically quarantined. We're going to communicate with you, ask about, for example, we had a soccer exposure. They were placed, they erred on the side of caution and said, okay, you can't go to school. We reviewed the context of that and said that students could go to school. And then we recommended that everyone get tested if they develop symptoms at any time and get tested if at day 5. So because remember when they're going to school, as long as they're asymptomatic and wearing a mask, we want them to be in school, even if they had a possible exposure. So an outdoor soccer would be one of those considerations that we would not want everyone placed on quarantine. So my recommendation would be to email us at COVID-19 schools at Marin County. We review those emails by the minute, even on the weekends, we have 4 boundaries. And so email us if there's a scenario, because the sports activity directly relates to the in-person instruction and we don't want students unnecessarily excluded.
Sorry, I think you answered this, but one more time. Do you see the mask mandate for indoor athletes changing anytime soon, specifically volleyball and basketball?
The state is going to revisit indoor masking on November 1st. And so I think a lot is going to depend on vaccination rates and COVID-19 activity across the state for the guidance from California Department of Public Health. I am anticipating that they are going to hold on masking, universal masking indoor recommendations until the next wave of students have the opportunity to be vaccinated. So we are preparing that the 5 to 11-year-olds will have vaccinations the week of October 28th. Then they'll get their second dose 3 weeks after that, so mid-November. So then they would be considered fully vaccinated that first week of December. So it's possible, not probable, there'll be a change November 1st. Let's say all of a sudden we just drop cases dramatically and hospitalizations drop dramatically. It's more probable that we would see a change early December after all 5 to 11-year-olds in the state had an opportunity for vaccination.
Can drama performances take place in indoor theaters as long as everyone's wearing masks?
Yes, and at this point, consult with us because during the actual performance itself, if indoors, we would like to discuss with you the possibility of letting the performers have their masks off during the performance, but not during the practice. So if there's a specific event coming up, email COVID-19 schools at Marin County. So if it's just practicing, don't contact us, wear the mask. If it's a specific event, contact us because it's under consideration for us to allow the performers not to wear a mask during the performance itself.
Are boosters recommended for all educators?
No. So boosters, those educators and school staff who should get a booster are those who receive the Pfizer, those who are over the age of 65, and those who are between the age of 50 and 64 with an underlying medical condition, diabetes, heart disease, and the underlying medical conditions are listed by Centers for Disease Control. Those who are under the age of 50, who are school staff, should weigh the risk and benefits of having a booster shot at this time. And again, it's only for those who receive the Pfizer. We're seeing Moderna outperform. Pfizer, but be aware that Moderna and Johnson & Johnson are submitting for FDA consideration and to the FDA approval for booster doses. So this is a place, if you're not in the two groups that I mentioned, we would recommend you talking to your healthcare provider. Again, the Pfizer vaccine itself is a mismatch. And so if you received the vaccine more than 6 months ago, you probably do have waning immunity. We don't know, the immunity waning would be more significant in those two higher risk groups. Those are the groups that the CDC is recommending. We're going to be issuing a public health advisory that we'll make to share throughout the public, helping to clarify that. But I think anyone that's under the age of 50, it really is going to be a personal decision if they want to get the Pfizer vaccine and if it's going to be to their benefit. Remember, it depends if you remember your second shot, and it does not come without side effects, getting a vaccine. A lot of people do feel very poorly for a day or two. And that's why CDC did not issue a strong recommendation for the under 50-year-olds, even though those who work in the school or more congregate setting, to get vaccinated. They may change that, but that's what the current recommendation.
Lisa, there was an earlier question about capacity, and you described the Civic Center, 1,000 people. So is there going to be guidance? Let's just say there's a gym that ultimately has, can somebody help me from a high school? Would your gyms have 1,000 people if everybody was crowded in for a basketball game, let's say?
Yes, they would.
They would?
Yes. Yeah, we could.
Okay. All right,
Yes.
So now Lisa, if you could.
Yeah, so if that's possible with the 1,000, then we would recommend the same thing we did for the Marin Center, where and I could share that with Mary Jane in this group, and I'll talk to Dr. Willis. So any facility that has over 1,000, we would recommend that vaccination would be required to enter, and you would allow the religious and medical exemptions for vaccinations, and then those who can't provide proof of vaccine would have to be tested within 72 hours prior to going in. So if that's the other option you have is not filling the facility up that much. Yeah. Again, especially my concern for Marin County is we have a cocoon, but the cocoon breaks when you have teams coming from other, and even within certain communities and some more vaccinated schools and some communities among higher vaccinated communities could have lower vaccination rates. Everything is more hyper local with vaccination rates. So that would be one consideration where you just don't allow the higher risk of having the 1,000. And we don't have recommendations saying, oh, you should only have a 25% or 50%, but if you can keep capacity under 1,000, that's a consideration. But knowing it still might have the same conditions, like 1,000 is an arbitrary number. So if you have 800 people, you still might have the same risk and conditions, and may want to have the vaccine verification process. We just know with our experience with Marin Center is that once you do that, you require more either infrastructure or staff, right? So it complicates it. So it's challenging. If you were to err on side of conservativeness, it'd probably be a 50%, not to give numbers, but probably keeping at a 50% capacity would probably decrease.
Well, and Lisa, the type of activity that's going on in a gym where kids are yelling and screaming and parents and jumping and all that compared to the civic center where they're likely sitting in their seats.
Yeah, I know how I'm at I stay away from people when I'm on the soccer field because I'm from Jersey. I scream a lot, so I just stay away. But that's the same thing. If you're indoor, those are the conditions that are at the highest risk. So is indoors, people screaming, yelling at their, to encourage the kids. That's what we want kids to do. And that's why vaccine verification might be a consideration to, optimize attendance while reducing risk.
Okay, that takes us to all the questions. Anybody have a question that didn't get answered or they didn't like the answer and you would like Lisa to clarify it for you?
And we understand, I try and answer every email. We do listen to feedback. We've heard a lot from coaches who are frustrated with indoor mask wearing by their athletes, especially once they are vaccinated. Once you have for example, you have a whole basketball team that's vaccinated. Why do they have to wear masks indoors during practice? And that's because it's a requirement from the state at this point. So we've heard that, and it's planted a seed in our brain that if we can, when we go down to moderate levels, and we can't be less restrictive than the state. So that's the first thing. Marin County, even if we have lower rates than the state, we can't be less restrictive from the state. But that's an example that I know that's circulating in my brain is that, I know that a whole basketball team is vaccinated. Can they return to practicing indoors without their mask on? So that for me is a goalpost that we're seeking to achieve. And hopefully the conditions at the local level and at the state level allow us to return to that before, by December, being cautiously optimistic.
Okay, I know that there were a couple of questions that came from our middle schools at a meeting they had last week. Any middle school leaders have anything that they wanted to ask specifically that didn't get answered? Okay. All right, so on that note, hopefully last week or a couple days ago, you got the notice about our need for volunteers as we are opening the vaccination pods for the 5 to 11-year-olds. And that will be a Saturday, Sunday, starting, I think, the 30th, maybe, if that's right, of October, and then again in November. And we're really going to be looking for a lot of volunteers. So if you can help us spread the word, that would be fabulous, getting the word out. So thank you for that. And just to note, we're keeping very specific data now about the Binex testing, and the results that we're seeing are framing that it's under 1% of all the symptomatic people who are testing positive. So that will be data that'll help us down the road. And we're over 536 so far that have been tested, and those are people with symptoms. So things are going well. Any other questions?
I have a silly question.
Nothing,
Sorry, Dr.
Tanisha,
Sanford.
there's no such thing as a silly question.
Can athletes or students briefly take down their mask, take a sip of water inside?
Yeah.
Okay, thank you.
I think the challenge is, and I totally appreciate it, teens and adolescents, it's their nature. They're going to be bunching up and hanging out together. And that's just the activity that you want to try and prevent on the school campus. We know once they walk out that gate and door, we know the masks are off, they're eating and drinking. What we're trying to mitigate are the school-based exposures that result in case investigation, contact tracing, and all that inside that environment. And again, with what Mary Jane just told you, especially among our, we don't see a lot of cases among the under 18. Of all of our cases, it's around less than 8% are amongst students under 18 years old in the total county. And again, knowing that this is a high unvaccinated group. So COVID is not a kid's disease. It's really an adult disease. That being said, we do have clusters in sports among kids and among kids and teens. And that's why we're being more conservative, especially with Delta. And again, hopefully we are moving from pandemic response to endemic response. I know everyone's fatigued. We really believe that this last push of vaccinating this 5 to 11-year-olds will be Marin's last kind of, we always have to be prepared for more, but it's going to be our last big public health effort. And then what we are anticipating going into the winter is just the return of the regular bugs like flu and other things, and that we hopefully be one of the first counties in the nation and in the world, honestly, that really returns to endemic level activities, and that people on a regular annual basis, based on the COVID activity that's happening globally, will make a decision whether they're going to get a booster shot on an annual basis. So our goal, and I know there's a lot of fatigue around wearing masks and mandates and orders. People are tired of public health. Our goal is to start unwinding this process. So that we're on this journey together. We're really seeing this as our last big push for the 5 to 11-year-olds. And again, we don't expect the same vaccination rates in that group. We know we're not seeing severe disease in kids. So a lot of parents are going to opt out, but we know that by the first week of January, every family, well, the sheer majority of our community will have had the opportunity for vaccination. And hopefully by that first week of December, we'll see low levels of COVID-19 circulating in our community. And just on a more global nature, even though we have thinking globally, that's one of our greatest risks, both from within our own state and within our own nation, where there are going to be virus mutations because there's going to be under-vaccinated communities, as close to rural California, as far as Alaska, and then as even further away to Vietnam. And that's where there'll be COVID activity, and we'll see how it mutates in future risks. But our goal is to really begin normalizing our routines, and then being kind and accepting of people who are more fearful and are still wearing masks, and helping them shift to more away from our fear-based reactions to a more fuller, holistic sense of life. So we're on the journey. It's our last big push, but I'm really optimistic that Thanksgiving might not be perfectly near normal, but the winter holidays should be a much more near normal experience for all of us.
Lisa, one final question. Do you still recommend campus to only essential visitors who are fully vaccinated?
At this point, yes. So what we're going to be doing when we go back to moderate levels of activity is look where we are. We're going to review we'll sit down, Dr. Willis, me, Mary Jane, and the rapid response team. We're going to look at all of the 30-point guidance, and looking that we're not returned to moderate levels. What are the things that we feel can release based on what we've seen with disease transmission patterns? So it's not just the science that's available and data that's available nationally or globally. We're really looking at our internal experience with COVID-19. And what we are finding, honestly, is that universal masking indoors is super protective, even in elementary schools where almost nobody except the staff are vaccinated. It's super protective. And so we'll be looking at relaxing. So we're looking at shifting from C to B in our mitigation strategies once we hit moderate levels, which would potentially include an outdoor masking as optional. So we're it's there, but we're still, like I said, we're still lingering in substantial a little bit longer than we had hoped to be.
Great. Okay, Lisa, as always, thank you very, very much. We appreciate it. Thank you to everybody. Have a great day. See you later. Bye-bye. Reminder, this is taped. Anybody can listen to it.